Hey guys, it's Dr. Dawn, Chicago's own board certified OBGYN. I am at home now practicing stay-at-home method and staying away from folks. So I was watching TV, and I have really refrained from getting on Facebook Live thus far because I think it's a lot of information out, and I've been referring my friends and family just to go to CDC or WHO to get the information, and then just call me personally. But I just had to get on today because it's really angering me about what's going on here with physicians working at the forefront of this pandemic. I've talked to different people about how doctors are being put in harm's way because we are not being given the PPEs that we need to protect ourselves while taking care of our patients. And a lot of that is because the hospitals just don't have it. But there are also a lot of instances of physicians having their own PPEs, having their own masks and things, and then being told by administration that they still can't wear those masks because it puts fear in our patients. Now, personally, I think our patients are smart enough to know that they should be having a mask, and anybody taking care of them should have a mask, especially if they're coming in with the symptoms. Symptoms of potentially a coronavirus infection are fever, cough, shortness of breath. But I came on today because of a story that was on WGN TV that is talking about physicians that have taken to prescribing medication for themselves that potentially could be beneficial in fighting the COVID infection. Why am I upset about that? Because it's all about framing, and it's all about the narrative that we're putting out there. Instead of doing a story about physicians putting themselves at harm's way, going to work, even though they know they could pick this virus up, but still going to work every day, still taking what they can in terms of protection and taking care of their patients, because that's what we do. We're putting a story out there about a few doctors that have prescribed chloroquine because they feel that might be beneficial to them. Is that the right thing to do? Absolutely not. Do I agree with potential physicians saying, hey, Dr. Donald, hey, Rochelle, hey, Denise, hey, Anika, thanks for joining me? Do I agree with those doctors doing that? No. But I believe that the few amounts of docs that are actually taking it upon themselves to get that medication to protect themselves, the numbers of docs that are doing that pale in comparison to the number of doctors that are actually going to work every day, whether they're protected or not, and taking care of patients. That's the story we need to get out there. And we need to get the story out there about people in the hospital, administrators, who are refusing to allow us to protect ourselves, who are refusing to allow us to use the masks that are available because they don't want to put fear in the patient population. Guess what? Anybody that's a patient wants their provider to come to them with a mask. I would bet dollars to donuts that if I were a patient coming in, I want my doctor to be with a mask. I want my doctor to have gloves on. I want my doctor to protect themselves, because we all know that there's only one doctor. We got to take care of everybody. And any doc that's going to work in the midst of this pandemic is going above and beyond what they signed up to do. We go to work every day, not just doctors, nurses, medical assistants, people on the floor, people that work in the hospital that give the food to people, people that work in the hospital that are cleaning the rooms. All of us are taking it upon ourselves to take our responsibility and do what we came to do. But for a story to be put out and focus on the few docs that took it upon themselves to write a prescription for a medication that might save themselves and their family, is it right? No. But we are putting the focus on the wrong thing. We are trying once again to make the doctor the bad guy, and that couldn't be farther from the truth. We need to protect everybody in the healthcare that is trying to take care of our patients. We need to take care of our patients and take care of ourselves. We shouldn't have to catch COVID in order to make sure that you don't get it. Now, I'm going to go to work, and I'm going to do what I have to do because that's what I signed up to do. But the doctors, the nurses, the medical assistants, the surgical assistants, the people that work in the hospital every day, we're not the enemy. In fact, we need help because there are a lot of people out there that are not working to make sure that we are safe. So Hopefully, this message will get back to WGN. I've been practicing medicine for over 16, almost 17 years. I love what I do. I love taking care of my patients. And I don't want to be put at risk, but I'm going to do what I have to do. But it's unfair for us to say that physicians are only thinking of themselves and not thinking of their patients, where there are thousands of doctors that are going to work every day taking care of their patients, knowing at any moment that infection is present or that virus is present, and they could pick it up. And it's not just about me picking it up. Please excuse my dog. Let me go let him out because he is getting really ornery. He does not want to stay in the house. Let me let him out. Sorry, guys. Okay, so there are a lot of people that are going, taking care of their patients, doing what they need to do, and they do it because that's what they've been chosen to do. Hey, Kenny. So, Kenny, police officers are out there every day taking care of people. They don't know who's out there. They don't know what these people have. And we got some ornery people that'll just start coughing just because. So we got people that are also police officers, people who work in the grocery stores, people who are delivering your packages that you all are getting because we locked up in the house. It's not right. And the narrative that people are trying to put out there is incorrect. Doctors, nurses, people at the forefront, firefighters, police officers, everybody that you depend on and that we usually kind of push off like, oh, well, those are the very people that are standing at the forefront trying to keep everybody safe. So I'm going to end this rant because I know it's not your fault, but we need to change the narrative. The narrative should be, let's all protect everybody. If I protect myself and I protect you, then everybody can be impacted. We're in this together, guys. That's what this virus is telling us. We're all in this together. Whether you make 7 figures or whether you're making hourly wage of $10 an hour, you can get coronavirus, you can go to the hospital and get sick. And also, it's not just people that are 60 and above. I can't tell you the number of people that I know who are physicians that have friends and family that are below 60, that are in their 30s and 40s and are dying of this infection. It's not just for people that are super sick. It's not just for people who have certain disease processes and, are 60 and above. People in my age group, and I will tell you, 49, people who are in their 40s, in their 50s, we're coming down with this infection and we're dying from it. It's not about, you can just go and isolate yourself for 14 days. You can come down with this infection and not survive. And that's what we need to know. So those of us that are in states where they're asking you to stay home, stay home. Don't take this seriously. Don't think that just because you are 35 that you can pick this up and stay at home and not have a problem. You guys are dying too. And let's also make it clear, there are only so many hospital beds, there are only so many ICU units, there are only so many ventilators. And my governor is working his tail off to make sure we have what we need. But in the meantime, if you come down with this infection and you are super sick, you're going to depend on the same doctors and nurses that WGN is talking about to take care of you. Okay. Thank you all for joining. I just had to get on and rant because I was furious. I do care about all of you guys. Stay at home if you can. Wash your hands. Practice the 6 feet distancing if you can. Spread the word and stay safe. I may jump back on when I calm down a little bit because I got a little mad. But for right now, we'll chat later. Bye, guys.